Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone, and welcome back to the show. It's great to have you here today on this Total Wellness Tuesday, where the topic is going to be going over LIFO and SIFO, and to see if you've ever heard of these particular digestive-based issues or if you might be suffering from them specifically. And one of the reasons why I wanted to go over these two topics here today is that it's essentially a new terminology that you will be hearing about in the future. So although in the functional medicine field, in the naturopathic field, it's been around for quite some time, the terminology hasn't been starting to be used mainstream until maybe the last year or so. So I wanted to make sure that you knew everything that you needed to about it, whether it's something that feels like it's a new topic to you that you need to explore deeper, and we can certainly go into that, or if you're actually dealing with LIFO or SIFO yourself. So I know there's also a lot of practitioners that listen to the show, which I love. I know about maybe 25%, 30% of all of our listeners are in the health field too. So this is something that your patients or your wellness clients might be asking you about. I'll give you the different tests that anybody can do, whether you're at home or whether you're a practitioner, with your patients or wellness clients to make sure that your clients aren't specifically dealing with these issues. And then I'm also going to have my team link up a number of shows in the podcast, or actually probably just the digestive-based channel, so that you can go deeper on these particular topics. Because today is going to open your eyes maybe to this particular issue in terms of health, and whether it's autoimmune, whether it's digestive, you're going to start to see the connection. So today's episode 1635. If you head over to stephencabral.com/1635, you'll be able to see the details on this specifically. And I'll also try to link up other items that you may need right there. All right, so let's get right into it. When we're talking about anything digestive based, we're really narrowing it down to, now there are multiple causes of this, but we're really narrowing it down to parasites, H. pylori, which is essentially a bacterial-based infection. You can get it in your stomach. And I've done shows on all these things. So again, don't feel like if you don't know everything you need to about these particular topics, you can't go back and go in more depth, because every single podcast that I do is really dedicated to one specific topic that we can get a little bit deep on for that 20 minutes, that 25 minutes. So today's not going to be any different. I'm going to allow you to get deeper on H. pylori if you want to on another show. So we've got parasites, we have H. pylori, we also have bacterial overgrowth in the gut. Sometimes we call that SIBO, which is small intestinal bacterial overgrowth. And then we also have candida overgrowth. Those are the four main issues we're dealing with. And then, of course, there's all sorts of other issues that go along with those. And you might hear things like diverticulitis, diverticulosis, Crohn's, colitis. You might hear about slow bowel motility. You might hear about inflammation of the gut. You might hear about intestinal permeability. But as you'll see today, many of those really come back to these underlying issues of this overgrowth of a particular thing that shouldn't be there, whether it's parasites. Those are basically what we call gut bugs. We've got bacteria, we have H. pylori, and then we have candida overgrowth. So let's go over those, what the new terminology is. And what I want you to think about is you've already heard the term SIBO. So I want you to start to be able to relate things, right? So SIBO, S-I-B-O, stands for small intestine or intestinal bacterial overgrowth. So what does that mean? Well, the first 20 feet or so, 21 feet, depends on the size of the individual, it can actually be longer. But the first part of your small intestine, or actually, let's go over it. So essentially you have an esophagus, that's where you swallow food, it goes into your stomach, and then your stomach has two main parts to it as well, but it moves through the gastric valve, and inside of the gastric valve is a little bit of a flap, and that flap then allows food to move into then the small intestine. First part of the small intestine is the duodenum, we've talked about that before. And then you're moving to the jejunum, and then you're moving to the ileum, all right? So that's just all small intestine. Then after the small intestine is done, there's another valve, and that's called the ileum or ileocecal valve. So it's the ileum, and it leads to the cecum of the large intestine. Now, the large intestine is about 5 or 6 feet for most adults. So basically it goes esophagus, stomach, small intestine, large intestine, and then that bacteria, which is predominantly, what your stool is predominantly bacteria, comes out of the body. So that's an oversimplified version, of course, but that's essentially your digestive system. So when you hear SIBO and you hear small intestine, well, you think, okay, that's the first part after the stomach. That's about the largest and the longest part. That's about 20, 21 feet or so. And even though it's called the small intestine, it's only because it's not as thick as the large intestine, but it's certainly longer, right? We could call it the longer intestine if we wanted to, probably make more sense. And then we have the shorter intestine. But that's where the SIBO comes from, small intestinal bacterial overgrowth. And the reason why it's called that essentially is because your small intestine is supposed to be a little bit more sterile. And it's not supposed to have as much of the bifidobacterium, the bacteroides, the Clostridium-based bacteria, etc., that's in the larger intestine, okay? So it's supposed to be a little bit more sterile and ideally a little bit more anaerobic or a little bit of a lower pH. And a lot of the more of the bacteria should actually be then in the large intestine. And that kind of makes sense because that's where the stool starts to, you're not doing a lot of digestion in the large intestine. And that's essentially where the body's creating the stool to then be removed from the body when you have a bowel movement. But what happens is, you can have bacterial backup or buildup in the small intestine. Now that's going to lead to specific issues we'll talk about in just a moment. But in the large intestine, not as much of an issue. However, we now have something called SIFO, which is small intestinal fungal overgrowth. Okay, so what does that mean? That means that the small intestine has fungal overgrowth. Okay, so again, SIFO, SIBO, some people will pronounce it differently, but it's easy to remember. Just if you say SIBO, you can say SIFO. So it's SIFO. So that means instead of bacteria overgrowing in the small intestine, we now have fungus overgrowing in the small intestine, right? We call it SIFO. We've always just called it Candida overgrowth, okay? So I don't want you to worry about it and think of this as a new infection, this is a new disease. It's just given a different pathology-based name. So I don't want you to worry that it's something different. It's just another name for Candida overgrowth. And the reason why I say that with confidence is that for the most part, 90+% of the Candida that is overgrown is Candida albicans, okay? So it is a Candida overgrowth, and a generic name for that is a fungal or yeast overgrowth. And that is because not every yeast or fungus is Candida. However, all Candida albicans is fungus yeast based. Okay, so it's A doesn't always equal B, but B could always equal A in certain circumstances. All right, so we have small intestinal fungal overgrowth, and then we have LIFO, which is large intestine fungal overgrowth or large intestinal fungal overgrowth. Okay. So there's really no LIBO, or LIBO, I guess we would call it, which is large intestinal bacterial overgrowth. It can happen. It absolutely does happen for sure, so don't get me wrong. It's just that the large intestine is used to having more bacteria there. Okay, so let's start to break this down further. Large intestinal fungal overgrowth, small intestinal fungal overgrowth. Well, different names really for Candida overgrowth. There's always Candida present in the intestines. However, it should not be at a larger amount. It should not be overgrown. That is an issue. How does this happen? Why is it happening so much more? Well, the reason why it happens so much more is that people are more stressed than ever. That's the truth. They're oftentimes, I don't know if they're drinking more alcohol, but alcohol is a big cause for it. Birth control can be an issue. Medications like antibiotics are a huge issue with fungal overgrowth. And that's because, as I've said it before, if you take antibiotics, again, sometimes you need to, right? They're life-saving. You have a staph infection. You had dental surgery. Now you have an infection in your gums and your mouth, and now that can lead to the heart. Believe me, I get it. There's a time and a place. Of course, you should be using natural health along with antibiotics if you ever had to do that. But a lot of people don't. So what happens is you take the antibiotics, you kill the bad bacteria, but you also kill a lot of the good. And then Candida is simply opportunistic, and so it begins to overgrow when all that bacteria is being wiped out. So as your body's taking a couple weeks to replenish the bacteria, well, that allows then the Candida overgrowth to inhabit the small intestine and large intestine. Okay, well, what does all that mean? Well, it means that when you're taking these antibiotics, or another big one is proton pump inhibitors or some type of acid blocker. Think about how many people are put on Prilosec, Zantac, Nexium, you name it, right? So they're taking things to block the acid in their stomach because their physician simply doesn't understand why the body's overproducing acid or sometimes underproducing acid where you get acid reflux. There can be things like hiatal hernias, which are called lower esophageal sphincter-based issues. There could be histamine issues. There could be hypochlorhydria, which is a lack of stomach acid production. So there's many different reasons why people get stomach acid issues, right? But none of them are solved. I mean, yes, you can mask the symptoms for sure. You mask the symptoms with an acid blocker. But the problem is it leads to so many other issues. There's a reason why people go on acid blockers or medications, and then a year later, 2 years later, they take another medication for the issues that these medications caused. But of course, from a conventional medicine standpoint, they never make the connection. Well, here's a connection for you. You take antibiotics, you get candida overgrowth. You take acid blockers, you end up with candida overgrowth or bacterial overgrowth, or both. And the reason is you slow bowel motility. That's just one reason, but you slow bowel motility because you need acid to actually come into the small intestine from the stomach, mixed with the food, because you can get bacterial overgrowth in the stomach as well. And the reason why that's important is then the body then begins to create what's called bile. And that bile is extremely important because if you don't have enough bile, you're not going to be able to help detoxify the intestines, and you're also not going to create proper bowel motility. That means not letting all the bacteria and all the food and everything sit there for days on end, that you're actually moving it through the body over the course of 12 to 24 hours or so. So again, extremely important. That's why although medication may be needed in the short term, it should never be used for the long term. And again, you can't not use it for the long term if you're not using natural health-based protocols. So you have to understand that. You can't just come off medications, and that's not what I'm preaching right now. You can only come off medications while, of course, working with your doctor, but by fixing the underlying root cause. So I'm always just trying to share with people there's always an answer. Your medical doctor doesn't always know the answer, and the reason is they didn't study natural health. They didn't study the underlying root causes. That's not their fault. It's not part of the education of what they get, just like I don't know how to do open heart surgery, right? I don't do that. I don't prescribe pharmaceuticals. I don't treat. I don't cure. I don't do any of these diagnostic-based things, okay? What I do is I look at the underlying root causes. I run functional medicine at-home lab tests, which is a very easy way to assess, do you have bacterial overgrowth? Do you have fungal overgrowth, right? Do you have vitamin deficiencies? I mean, you can look at everything that you need to. It's not as challenging as it used to be, that's for sure. Anyway, I don't want to digress too far here. So let me just go over some of the signs that you might have a SIFO or a LIFO, right? Which, and again, just candida overgrowth, okay? So I'm going to link up previous shows on that. But, I mean, dead giveaway, of course, is a white film on the tongue. We call that oral thrush, or just thrush. Women can also get vaginal thrush. Even children and babies can get thrush, okay, and vaginal thrush as well for females. So really important, that's a dead giveaway, right? That's an easy one, but it's not like that for many people. Fatigue or brain fog is a big one. Yes, it can be thyroid, it can be other issues. It can be adrenal HPA axis issues. There's no doubt about that. There's no doubt about it. But it could also be candida overgrowth or LIFO SIFO. Okay, digestive issues, that's a given, but let's look a little deeper. Recurring urinary tract infections, that's a big one. Prostatitis in men can be a fungal-based issue. How about yellow nails or fungal overgrowth of the nails? Joint pain, that's often overlooked, but joint pain can be fungal in nature. Skin rashes, another big one. Skin rashes can be some hair loss or alopecia. Can be fungal based. I've seen a lot of that, okay? And I'll just give you one more, and it's kind of a big all-encompassing, but it's autoimmune issues. If you are always turning on your immune system, and the immune factors typically, not always, but typically for autoimmune issues have to do with intestinal-based permeability, and then how your immune system reacts individually, okay, for autoimmune issues. So we get bacterial overgrowth, we'll go over that in a minute, or we get fungal overgrowth, candida overgrowth, and we end up with intestinal permeability, which can also happen from alcohol, stress, antibiotics, etc. And then we are leaking bacteria, we're leaking proteins, we're leaking toxins. The immune system gets aggravated. It turns on to a higher degree because there's more of that now in the bloodstream. And that aggravated immune system could end up eventually as some type of autoimmune issue. Which autoimmune issue do you get? Well, that's when genetics matter, right? So I'm not saying genetics don't matter. You'll end up with whatever your genetics say you're going to end up, which is MS or rheumatoid arthritis, etc. Okay? So there's no doubt about that. Genetics matter. But as you saw, genetics only get turned on when the environment is proper for it to be turned on. And that's why it can also be turned off. So LIFO, small intestinal fungal overgrowth, large intestinal fungal overgrowth, also associated with gastric ulcers. That's part of the small part of the last part of the stomach. Crohn's disease, ulcerative colitis, etc. So again, when you're looking at these particular issues, we have to look at a deeper meaning for them. All right. One more big one I'm going to give you before I shift gears as to how Candida overgrowth or fungal overgrowth is different from bacterial overgrowth, because it's an important differentiator, is that Candida overgrowth, fungal overgrowth, yeast overgrowth can also create biofilms. And biofilms are a big issue. If you don't know what biofilms are, I highly recommend going back, tuning into one of my previous shows. And what I'm going to do right now is I'm going to have my team try to link that up on today's show notes page. So just head over to stephencabral.com/1635, or even just stephencabral.com/podcasts, and you'll find all those previous podcasts. Okay, let's move on to, because I do want people to know, there is a big difference between bacterial overgrowth and Candida overgrowth or fungal overgrowth. So what's the difference between SIBO, small intestinal bacterial overgrowth, small intestinal bacterial overgrowth, or a SIFO, small intestinal fungal overgrowth? Well, I just named all of the issues of fungal overgrowth. Okay, those were the symptoms, right? Keep in mind, bacterial overgrowth can mimic all of those as well. That's the challenge, right? But I'm going to share with you at the end. It's actually not a challenge for health practitioners. It's honestly not. So here's the big difference, though. Candida overgrowth, and a lot of practitioners don't know this, so I just want to share this because this is what I found through my research as well. Candida overgrowth, fungal overgrowth, does not produce hydrogen or methane gas to the degree that bacteria does, because it is bacteria that is actually giving off the hydrogen or methane gas, which is causing a lot of the cramping, the bloating, and the gas. Now, in all fairness, just to be fair, for those people that said, well, Candida can cause cramping and bloating as well, and I agree, because Candida can actually begin to ferment fructose and other foods as well, but fructans is certainly one of them, and that can cause a different type of bloating, cramping, gas, diarrhea. Okay, so yes, but if we're talking about hydrogen gas and methane gas, more exclusive to bacteria, because humans do not produce hydrogen or methane, but the bacteria that we have in our gut do. And when you look at the 100 trillion bacteria that we have in our gut versus, I always like to say, the 40 trillion of us, you can see how much bacteria is actually there. And it's why they need to be kept in check, right? We need them. We absolutely need them. Why? Well, if we don't have enough bacteria, proper bacteria, what's it going to do? It's going to cause iron deficiency. It's going to cause B12 deficiency. And if you have lack of stomach acid, that's why these proton pump inhibitors and other drugs are so harmful. Well, you're going to have less zinc, most likely, less calcium, less magnesium. You're going to create osteoporosis, all sorts of other issues. Again, nobody's talking about that, right? They're just talking about, oh, well, when I take it, I no longer get acid reflux. I understand. Acid reflux is not fun. I had it, again, when I was really sick, 17, 18, 19 years old. I was put on daily Prilosec, so I get it. It was one of the other reasons why. It wasn't the only reason, of course, being put on antibiotics for 3 straight years, every single day, swallowing 3,000 capsules of amoxicillin. That's going to cause my SIBO and my LIFO and SIFO as well, right? And I also had H. pylori. So believe me, I know about gut-based issues and how uncomfortable they are and having to rebuild. I had to rebuild all of those. I was super deficient in B12, same with zinc, same with calcium, same with magnesium. Like, there's no doubt about it. Okay, so let's get back to it though. When you produce that amount of, let's say, hydrogen gas, you're probably going to end up with more loose stool. Okay, that's an issue. But if you have more of the bacteria that produce methane gas, you may end up with more constipation. And biliary is what we call biliary dyskinesia. So we're ending up with all sorts of bile-based issues as well, liver-based issues. Okay, this is important, because then it throws off the osmosis. It throws off the, what do we call it? The peristaltic movement of the intestines, which means now it is a self-perpetuating cycle. The bacteria begins to continue to overgrow. Candida begin to overgrow. You have more gassing, you have more cramping, you have more bloating. And this gas, this hydrogen gas, this methane gas, it actually gets absorbed by your bloodstream and it goes to the lungs. This is why you can do a breath test. As much of an advocate of the breath test, back in the day, it just used to look at hydrogen, it didn't look at methane. It really depends on the serum or the solution that you're drinking. I really prefer, if you really want to know if you're dealing with this right now, is it Candida overgrowth or SIFO, LIFO, or is it SIBO? I'm a huge advocate of running an at-home, we call it the Candida Metabolic and Vitamins Test at equilibriumnutrition.com, or the Bacteria and Parasite Stool Test. You can also run an at-home food sensitivity test if you'd like, okay? The most important one, in my opinion, is to run that Candida metabolic and vitamins test, then the bacteria and parasite stool test, and then if you want to do the food sensitivity test, that would be a number 3. Okay, you can run them with your integrative health practitioner. You can run them with your naturopathic doctor. You can run them with not every functional medicine doctor knows how to do this. Some doctor, again, nothing wrong with that. Some functional medicine doctors just have training in more of hormone-based therapy, and that's fine. But remember, a lab test is only as good as the practitioner reading the lab. That's it. Because they have to know then, okay, you're high in this, or I see this happening, or it looks like it's trending towards this, and then they have to be able to give you a protocol to be able to rebalance the body. We use the CBO protocol. Thousands and thousands of practitioners use the CBO protocol that we've developed from many, many years ago. It honestly does work great. It comes with a specific sensitive gut guide, all of these things. My goal today is not to say you need to do any of those things. My goal today is to make you aware. The podcast is about education, but I also needed to let you know of what you can do. So, of course, you can always work with our team at equilibriumnutrition.com, but you don't have to. I always want people to know that. My job in this podcast is to give you the education, to let you know that these things exist, but to also let you know that there's always an answer. There is always an underlying root cause answer. So you can work with someone locally, you can work with our team online, you can work with someone virtually, anywhere in the world. That's the great thing about now a virtual-based health practice. So what I want to do is just, again, share this message with people. I have thousands of podcasts, right? Well, it's not thousands yet. It's episode 1635. But there are dozens of other digestive-based podcasts. I go into parasites. I go into biofilms. I go into Candida more in growth. I go into bacterial more in growth. So anytime you want to do that, just go to StephenCabral.com/podcast. I'll do it right now with you. And then at the top of, whether you're on mobile or whether you're on your desktop, there's a graphic. It's the second one. It's called Fix Your Digestion Forever. And you just click on that. And if you just want to direct hyperlink it, you can go to StephenCabral.com/topic/digestion. And it gives you all of my digestive-based podcasts. So if you're really into fixing your digestion, I give you our entire protocol. I tell you the ingredients we use. I open source. What I'm trying to do right now is open source natural health to truly use integrative health practice for everyone. That's what it's all about. So hopefully this was helpful. Again, if it was, please do feel free to share this message with anyone you believe it can serve. And I just want to share with you right now, I'm at home, I'm in my room, I'm recording just on an Apple headset. So if it wasn't the best audio, I apologize. I'll be back in my office on Monday. This was a weekend makeup podcast that I wanted to do. So hopefully this was helpful. Again, thank you so much for tuning in. Thank you for the reviews. Really do appreciate them. Take care. I'll talk with you soon. Did you know that the body really only becomes sick or imbalanced in only 2 ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to StephenCabral.com/rainbarrel.